Hello, welcome to our Mental Health Minute. This is Dr. Saad, and we will be discussing about major depressive disorder or depression. Now, depression is not just sadness for a day or two, it's a clinical condition characterized by persistent loss of interest, persistent feeling of sadness, which affects the daily functioning. Now, it is very prevalent in the US. Approximately 21 million of adult population has one major depressive episode in 2021. In adolescent between the age of 12 to 17, this is 20% of the population. Approximately 1 in 5 individual had major depressive episode in 2021. So, what are the symptoms of depression or major depressive disorder? Number 1, persistent feeling of sadness, emptiness, or hopelessness. They also complain about loss of interest in the hobbies which once people enjoyed. Patient complains about difficulty falling or staying asleep, or maybe sleeping too much. We also noticed change in their appetite or weight, so maybe increase or decrease in them. Patient with depression also complains about difficulty concentrating or making decisions. They have this complaint about chronic fatigue or tiredness, maybe complaining about body muscle pain or aches. And in severe cases, patient may experience suicidal or self-harm thoughts. So as we see, this is a constellation of symptoms. What are the causes of it? Well, we've seen a combination of environmental, biological, genetic factors, along with stressors in life like loss of loved ones or trauma, or sometimes a combination of these factors are contributing to the development of depression. Treatment. Well, we do a combination of therapy and medications. So in therapy, cognitive behavioral therapy is very effective, which helps rephrase or we would say like help in the changing a negative thought process. Medication like antidepressant helps regulate the brain chemicals to alleviate the symptoms. And then lifestyle adjustment are very important, like regular diet and exercise, sufficient sleep, and having a good social support really is important in improving the overall mental health being. One thing is very common is that despite the prevalence of depression, there's a lot of stigma in going to a psychiatrist or therapist when it comes to seeking help for mental health. So we need to spread the importance of mental well-being. So if you yourself or somebody you know is suffering from depression or really needs help, please provide the help. Please connect them with psychiatrist, or at least connect them with the local the practitioner, right? Who can also refer them to a specialized doctor. In case of suicide or self-harm thoughts, in the US, they can call or text 988, which is a suicide helpline available 24/7. So very important resource to utilize. In summary, MDD is a serious condition. It's not a personal weakness, it's a clinical condition. But with the right treatment and support, recovery is possible. We need to collectively spread the awareness, foster understanding to reduce the stigma, so that in this way we can help create a society where mental well-being is prioritized and seeking help is normalized. Thank you for joining us today.